I was home not even a week, and I was in extreme pain. And Ray came home and he could see through my clothes how swollen it was. And he said, we have to go to the emergency room.
I had no idea that something like this could even possibly happen at today's age.
So the first time I saw Miss Maurice, she actually had come into the office with her husband complaining of a lot of pain in her hip. We started to talk a little bit, and she had an unbelievable past few months. She had a hip replacement done at another hospital, and a few days later noticed that she had some increase in pain and some redness. She was diagnosed with a joint infection. The infection that she had was a very, very bad infection. They eventually took her back to the operating room to see if they could get rid of the infection, and then that's when things started to go very, very badly. Her kidneys shut down, she developed blood clots, and she actually ended up in the ICU for a few months, very close to death.
We turned to Northwestern. When we went there, it seemed like we went to the pros. It was the difference of night and day.
So they put this articulating antibiotic spacer, and it's a pre-made spacer that you can see. So she came in to see me with a tremendous limp. Mm-hmm. And as you can see, the problem is not only the articulating spacer with an E. coli infection, but she developed a significant amount of heterotopic bone around here. Anytime you have to go back in and reoperate on a hip, there's a lot of scar tissue that could cause a significant problem. There's also an increase in risk of infection as well.
He told me, you don't have to have the surgery. You can live with, as you are, you know, with a walker and a wheelchair. I didn't want to live that way. And so Dr. Puri helped us.
This is what everything looked like after we were able to take out this spacer and redo the hip. The age of patients who have to have hip replacements is going down, meaning younger patients are needing hip replacement, which likely means that we'll start to see more patients who need to have revisions in the future. So every one of the patients who is operated on here, who has either a hip or a knee replacement, has a full team of physicians. We have an anesthesiologist who helps us in the operating room, and then we have an anesthesiologist who helps us with pain after the operation because that's one of their specialties. We also have an internist or a medical doctor who's able to take care of things like high blood pressure or diabetes.
Taking the dog for walks in the park with my husband, I mean, that's something that we've always loved to do. Going back to work, I absolutely love my job.
Now it's just talking with the grandkids, going for the walks, going on a vacation where Jan can now actually walk down a beach.
I didn't see any hope. But, you know, things got better, and now I feel like I am the luckiest person alive.